devices. It's an important technique used to treat many patients in our institute, and I'm also very happy to welcome our friends from press who always support Apollo Hospitals, and also very happy to welcome our Managing Director, Ms. Sunita Reddy, for her presence today here. She always guides us and inspires us and motivate all of us, and for all the doctors, she extends extreme support to perform these kind of procedures in our hospital. And I also welcome Dr. Sengutuvelu, our Senior Consultant Interventional Cardiologist. As we know that our hospital started 40 years back with our chairman mission to bring international standard of care to reach of every individual. And one of the main department when we started it was cardiology. And so it is so apt that today, out of marking 40th year of our hospital inception, now so much advancement has happened in the field of cardiology. And incidentally, yesterday we celebrated the 40th year of cardiac surgery performance by our leading cardiologist, Dr. Girinath. And it is a milestone because he introduced the cardiac surgery to our country. And same way now, beyond cardiac surgery, what is in the interventional cardiology? There are so many progress in medical field. Newer therapies are available. One such therapy, one such interventional procedure that Dr. Sengutuvelu will be talking to us. Our Institute of Cardiology has complete spectrum of care. It is from angiogram to angioplasty to multivessel plasty to using the innovative method of multiple techniques in treating patients. And today,
everyone, namaste to our wonderful patients who have this trust in us. Thank you so much for coming to Chennai for this, and to come to Apollo. It shows that you have trusted the institution, and this is what we value most. I think in a world where things are changing very fast, the fact that Apollo over 40 years has earned the trust of over 20 million patients is testimony to the fact that we are committed to do the best in terms of patient care. And today, Dr. Sengutuvelu spoke about cardiology, and I think they started with the fact that our chairman was a cardiologist and came back from the US to practice in India. And of course, you know, cardiology has always been very close to his heart, pun intended. But and his commitment to see that, you know, that we raise the level of work being done in India is what you see. Having said that, Apollo is it's a combination of what we do for the heart. It's a combination not only of what Dr. Sengutuvelu demonstrated, which is really minimal invasive, but it's also about the complex bypass surgeries. It's about treating structural hearts. It's about doing our best for pediatric cardiology cases. It's about transplants. It's a combination of skills that we bring together for the sake of the patient. And we do this knowing that each patient is unique. So I think, you know, unlike many centers, we focus on what the patient needs. And I think that's what Dr. Sengutuvelu demonstrated today. There is no single protocol because each of you are different in every way. And India by itself has the highest cardiac disease burden. I heard long ago that's because, you know, structurally our arteries are smaller than those in the West. And therefore, if you look at India, and in particular the states of Tamilnadu, Karnataka, Kerala, Punjab, the incidence of cardiac disease is very, very high, and it's only rising. So unless we give an opportunity to our trained surgeons, our interventional cardiologists, and those who are working for preventive care. I don't think that we will ever be able to solve today's problem, and more importantly, the problem of the future. In terms of volumes, Apollo has done over 300,000 interventions, angioplasties. We have done over 200,000 cardiac surgeries. This gives us a level of knowledge, it gives us intellectual property, and we're using this. We're using this to scale the program. So while we spoke about what was done in Chennai, our doctors go all over India. In fact, they go across the world to treat patients. In India itself, we have patients from 147 countries coming to Apollo for care. This itself is proof that we continuously benchmark ourselves with the best in the world. Part of that is technology, and we've been very, very quick adapters of technology in the space of prevention, where we have the 360 cardiac scan. So it's minimally invasive. It's not invasive, but it gives you a good picture of the status of your arteries. From technology, which Dr. Sengotivel spoke about, to what we do in terms of training our doctors to bring requisite skills, I think the combination has been a very powerful answer to the threat that poses India today, and that is the high incidence of cardiac disease. Having said that, I think Apollo celebrates 40 years in the field of treating patients, of earning their trust. In the process, we have learned a lot. In some of the disciplines, we're even using our data and AI to make sure that our protocols are the right protocols. But more importantly, we are now looking at prevention with a much higher focus. And in prevention, I believe we can find a solution to prevent patients from really having to go to a theatre to get a great clinical outcome. So part of the prevention is very important, and I really do want the press to speak about the good work that was done in Apollo for all patients, the fact that it is unique, the fact that we have the largest cardiac program in the world in terms of volumes, but more importantly to also talk about prevention. And as we celebrate our 40th year, we must remember that the impact that hospitals like this have made on life expectancy. There's been an improvement of 40% in terms of from the time that Apollo started to where we are today. And this is really what we can do. We will continuously improve these benchmarks. We will continuously innovate, and we will be successful only if we do so together. So thank you, ladies and gentlemen, for coming, and thank you, deep gratitude to our patients who put their trust in us, and of course our wonderful doctors who never stop trying. Your commitment has been absolutely central to our success. Thank you.